Today in the series of lobar assessment at bedside, we will discuss the parietal lobe. It is the cortex of awareness. A patient has a normal power, normal sensation on crew testing and speaks fluently. Most of us conclude there is no focal deficit. But parietal lobe lesions can be profound yet completely missed in routine motor and sensory examination. The parietal lobe integrates sensory input into perception and spatial awareness. It is the cortex of somatosensory integration, body schema and spatial orientation, attention, especially the non-dominant parietal hemisphere. So damage here does not cause weakness, does not cause sensory loss, it causes loss of awareness to stimuli. This produces agnosia, neglect and apraxia. These are higher order sensory deficit and not primary sensory losses. Most of the stroke studies show that right parietal lesions frequently cause hemispatial neglect and are often undiagnosed. Neglect is associated with worse functional outcome than motor deficits. So what are the bedside tests? Double simultaneous stimulation. You touch both sides. Patient reports only one side. It indicates a sensory neglect. Line bisection test. Give a straight line, ask him to find the midpoint. He deviates it from the midline. It suggests spatial neglect. And the classical clock drawing test. All the numbers will be crowded on one side. Stereognosis. They cannot identify familiar objects by touch. Indicates parietal sensory integration failure. Neglect is not a visual problem. It is an inattentional deficit. It is an attentional deficit. Patient can see, but their brain ignores one half of the space. Dominant parietal lesions produce Gressman syndrome, agraphia, acalculia, finger agnosia, and left-right disorientation. So don't ask the patient, can you feel this? Ask the patient, can you feel and interpret what you feel? Always test both sides simultaneously. Unilateral testing misses the object. Observe the behavior. Patient may eat food from one side of the plate. This is the classical bedside diagnosis. Parietal lobe disease is not a loss of sensation, it is a loss of awareness.